Kia ora koutou katoa. Today I will set out our plan for the next steps in our Covid-19 response, including details of the phases of our public health management of Omicron and what that means for the testing and tracing process. We've begun a new chapter in our fight against Covid-19. Omicron is here, and we have changed our strategy to minimise Covid-19's impact on people and protect the critical systems that support our health and wellbeing. Almost no country in the world has escaped Omicron, and New Zealand is no exception. But where we can be an exception is how we minimise the virus and protect our people from it. Our systems have adapted at every stage of the pandemic, but you have all played a vital role too. New Zealanders step up when there's a job to do, and this has served our communities well through the pandemic. Our high vaccination rates, the hard work of our public health team, and the COVID protection framework have meant we have been able to do what many countries around the world could not do. We've reduced the spread of Delta, emptied our ICUs of COVID cases, and we're now in a good position to manage the spread of Omicron. From what we've seen overseas, we know Omicron is the most transmissible COVID variant yet, so we expect it will spread fast, causing case numbers to grow rapidly and putting our health system and other infrastructure under considerable pressure. International reports suggest new cases from Omicron double every 2 to 4 days. This means a 10-case outbreak could reach 1,000 new cases per day in just 6 to 12 days. We have planned for a high prevalence scenario where cases could be in the tens of thousands per day. I know that these sorts of case numbers will sound scary to many people. 2 years into this pandemic, many of us are still unaccustomed to having COVID around us, but it's important to remember that COVID-19 is a different foe to what it was in the beginning. The Omicron variant is markedly less severe than prior variants. One US report suggests the hospitalisation rate is 10 times less than Delta. Its transmission and severity is also reduced by vaccination. So for most people, it can be a mild to moderate illness that you can manage at home. We also have the advantage of watching and learning from other countries. Most other countries have had to get boosted in the middle of their outbreaks. Our plan has given us a head start, and nearly 60% of eligible New Zealanders have now had their booster, and 1 in 5 children under 12 have had their first dose. I'm particularly pleased to see that over 73% of eligible people over 65 have now been boosted, and every DHB is on track to complete their booster program in aged residential care next week. We need to use the coming weeks before the virus could significantly take off to get as many people boosted as possible. Getting boosted will play a major role in preventing serious illness and keep pressure off hospitals. If it has been 4 months since your second dose, you are due for a booster. Please go to Book My Vaccine to make an appointment, or simply go to a local drive-through vaccination clinic, GP or pharmacy. The Health Point website has a list of all the vaccination sites in the country. Vaccination sites are open today across the country, and we will be standing up additional surge capacity this week in anticipation there will be additional people who will now be wanting to make sure their vaccine is up to date. And for those with you with children aged 5 to 11, all children aged 5 to 11 can now be vaccinated, and I encourage parents and caregivers to seek out information to help you make that important decision. Already, around 20% of children have been vaccinated or are booked to do so. We have been planning for 3 phases for Omicron. This plan sets out the actions we will be taking in testing, contact tracing, case management and isolation, in quarantine, care in the community in response to Omicron in our communities. Phase 1 is where we are now, and we're doing what we have successfully done with Delta, using our tools from a stamp it out approach. This will all be familiar to you. The tools we have used to stamp out outbreaks in the past can also be used to slow the start of an outbreak, giving more time for people to get boosted. And that's why we are currently taking an intensive approach to contact tracing, including tracing secondary contacts. We are still asking that everyone who is symptomatic be tested at a community testing station or primary health provider. If you are required to isolate, you will receive advice and, if needed, support to do so. At this stage, you'll need to isolate for 14 days if you are a case and 10 days if you are a contact. These intensive measures can be sustained while numbers are low. Once Omicron becomes established in the community, we will adjust our approach under Phase 2. In Phase 2, our public health efforts aim to slow the spread of the virus. This means reducing the number of cases to a level our health system can cope with. Importantly, because of vaccination and systems improvements, we are in a much better position than we were 2 years ago. The system will focus more on identifying those who are at a greater risk of severe illness from Omicron, which will be a small percentage of cases. As has been the case since the early days of Covid-19, we need to continue to adapt our public health response to safeguard the health and well-being of New Zealanders, and when Covid-19 changes, we change. Any rapid escalation in case numbers will put pressure on our resources and will require us to shift from identifying all infected individuals to being more targeted to those most at risk and those needed to keep the country going. At this stage, most people who are able to will start to be managed through our digital tools. Support from health and welfare services will be provided as required. Text message notification for positive cases will begin at this stage, with phone support still available for those that need it. Contacts will also be notified by text message. Household contacts will be actively managed, with close contacts requiring a day 5 test. As part of the text notification, individuals will receive a link to an online portal called the Covid-19 Health Hub. This will provide tailored health advice and resources on everything a person needs to know in clear, translatable and accessible formats. The Ministry and GPs are already working to identify those who do not have internet access or capability so that when they become a positive case, they will automatically be flagged to receive a phone call or outreach service to connect with them. If people cannot access online resources, they can still get support from other channels. Healthline remains a key communication channel in responding to the pandemic and can help you with clinical and non-clinical advice. You can reach them on their dedicated line, 0800 358 5453. These measures will slow the spread of the virus, but they shouldn't disrupt critical services that underpin our well-being, like our food distribution or electricity generation systems. It doesn't make sense to take action on one public health threat only to create another threat to our well-being. We are currently in the process of identifying critical sectors and we will have more information on this soon. Generally, workers in critical sectors are those who are required to undertake their role in person at the workplace and in a role that must continue to be performed to either prevent an immediate risk of death or serious injury to a person or animal, or prevent serious harm to significant numbers in the community. This is ultimately about ensuring the well-being of all New Zealanders. This has been the principle of our COVID-19 response right from the beginning. We will continue to manage testing of symptomatic people and close contacts at Phase 2 with PCR testing, but we will be enabling a test to return for asymptomatic critical workers who are close contacts of cases by using rapid antigen tests. These people, like our healthcare workers and those working in food supply and infrastructure, are key to our COVID-19 response and also ensuring New Zealanders can continue to access the services they need. Strict protocols for those testing to return to work for critical workers will include daily symptom checks and daily rapid antigen tests prior to commencing work, strict use of a medical mask put on before entering into the workplace, changed as needed during the day, and strictly complying with any infection prevention and control protocols at work. When the mask is removed, for example, for eating and drinking, physical distancing must be maintained. Eat alone or in a well-ventilated space where possible. Travel alone to and from and around work or between jobs. Ensure good ventilation when in small spaces, and masks must be worn by everyone present. Continue regular workplace surveillance testing if this is already in place. If symptoms develop at any stage, the worker will follow the public health advice for close contacts with symptoms. Testing remains a cornerstone of our response, but when and where and how we manage our testing will change once Omicron becomes seeded in the community due to its highly infectious nature. Rapid antigen tests will become the go-to testing tool. They perform best when case numbers are high and can give a quick result without drawing on laboratory or transport systems. The use of rapid antigen tests will enable PCR testing to be protected for use in key workforces, such as healthcare, for surveillance at the border, and as diagnostic process in hospitals and acute care settings. We currently have good stock numbers of rapid antigen tests and will release more details on the application, distribution, supply and funding for them in the coming days and weeks. We are already in the process of preemptively supplying rapid antigen tests to healthcare sectors, organisations with critical workforces such as energy and food supply, among others, and providers who work with vulnerable populations, including Māori and Pacific providers. Critical infrastructure businesses that have eligible workers deemed to be critical workers within that organisation will be able to order rapid antigen tests from the Ministry of Health via an online portal. Specific guidance on the process for businesses and critical sectors will be distributed in the coming days. Importantly, as the Prime Minister previously said, testing will remain free and available when you need it. At the third phase, our public health response will be about minimising a widespread outbreak. When cases are in the tens of thousands, we will then make further changes to contact tracing. Locations of interest and push notifications will be paused, but keeping a record of where you've been by using the COVID Tracer app will be important as it is now, so that if you can get sick, you can identify where you were. Public health units will be focused on managing the outbreak in very high-risk settings, such as prisons or aged residential care. It's worth noting that we don't expect to be at this situation in a few weeks. Self-service tools for contact tracing and rapid antigen testing will be important to help us respond to the high volume of Omicron cases. The care in the community model will see the majority of positive cases supported to self-manage at home, and clinical care and welfare support will be available to you and prioritised as needed. Your GP has an important role in this as a person who knows your individual health needs and how COVID-19 may impact you. By identifying patient cases early, we can effectively plan and ensure our hospitals and primary care providers are freed up for our vulnerable communities. Other technology solutions are under development and will enable the upload of rapid antigen tests results and to view test results and vaccination records. This enables those who are digitally connected to have access the information they need, but it is important to note that, as always, public health units will be available to respond to complex outbreaks, and iwi, Pacific providers and other NGOs will provide whānau with care and support. These technology solutions are being developed at pace, and more information on them will be available over the coming weeks. Through the course of each stage, we have a test to work regime that will allow our critical workforces to keep them going over the outbreak. Today we've gone through the details of public health operations so that everyone understands that the response will change as the outbreak does. But our message to the public is simple. Get boosted. Wear a mask in indoor settings. Follow the basic hygiene rules we've become so familiar with, and reduce contact when out and about as much as possible. We're going hard and early with our public health response as we have previously, but the health system cannot do it alone. As always, what each and every one of us can do as individuals will be what makes the difference to us as a collective. Omicron is now in 80 countries around the world. By delaying its arrival here, we've had time to kick off with boosters, vaccination for children, and to prepare our public health response. I encourage everyone to use the coming days to take steps at home with your family, neighbours and community to make a plan. Resources to help you do this are on the Unite Against COVID website.